it audible?
Good morning, everyone. Am I audible? أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. الحمد لله رب العالمين. الرحمن الرحيم. مالك يوم الدين. إياك نعبد وإياك نستعين. اهدنا الصراط المستقيم. صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين. آمين. صدق الله مولانا ولي. Thank you, everyone.
Thank you, Dr. Janelle. Now I kindly request Dr. Rekha P. Shenoy, Professor and Head of the Department of Public Health Dentistry, to deliver the welcome address.
Thank you, Dr. Supriya. Good morning and a warm welcome everyone present in the forum in this virtual program on higher education and work opportunities for dental professionals, the scenario in Australia and New Zealand. Human migration is an expression of aspiration for a better future. We organize this program as we have observed that a large number of our students either move abroad or express an interest in going abroad, but they often have a lack of knowledge or inadequate access regarding the opportunities available in different countries. Today, I have the privilege of welcoming as chief guest Dr. Ganeshwari Pachma, former head of Department of Public Health Dentistry at the Yenapoya Dental College. Sir has been a mentor to all the faculty and students who have worked here for more than 25 years, and I could not think of anyone who is more appropriate to be the chief guest of this program, given Sir's wide knowledge of opportunities abroad and his extensive travel in India and abroad. Sir, it's an honor to have you here, and I welcome you to the program.
Thank you, Dr. Rekha. Good morning, everyone. Dear Professor and Head of the Department of various colleges, Public Health Dentistry, faculty members and postgraduate students in Public Health Dentistry, and my dear interns and students. I'm very pleased to be with you this morning. Actually, being a former president of IA PhD, chairman of Oral Health Policy, and founder member of Indian Association of Public Health Dentistry. More than that, I'm very proud that I'm the one who started the Department of Public Health Dentistry in Manipal College of Dental Sciences, Mangalore, and also I was a former professor and HOD of Public Health Dentistry in Yenapoya Dental College. They're all proud moments for me, and I'm immensely pleased to be with you. One of the beautiful things about this dentistry is that each one of us, we can practice and work as a professional anywhere in the world. Dr. Manjunath, he worked with us, and he is very focused person. He was trying to go to New Zealand to start a professional career. And he mentioned to me right from the beginning that I saw him very focused, the way he went. That time I told him, I'll be visiting you one day, Manjunath. Now he's settled in Australia. I visited him, and that was my solo trip. Before I went with my family, I visited Australia and New Zealand. New Zealand was a solo trip for about 21 days. I went to different parts of New Zealand. It's a beautiful country like India. See, the intention of this particular symposium or continuing education program and giving you information is not that we want you to leave India. India is a free country. You have all the freedom to decide where to go, where to practice, and where to continue your professional career in any part of this world where it is allowed. The reason for that is up to you where you want to settle. And most of us at this particular time, when we are interns, when I was an intern, we were not knowing how to go to other countries. And what are the opportunities you have got? It is very important. It's for us, the seniors and the HODs, to inform our fellow colleagues about the scope and the method in which you can enter other country and continue your professional career. Again, I repeat, that doesn't mean that we are telling that you can leave this country and go. It's up to you. And most wonderful thing, again, I repeat, that in this profession, you can practice anywhere in the world. I'm really grateful to Dr. Rekha, who has taken charge of our department, and for inviting me and also organizing this particular program. I wish you all the best. Good luck. Thank you very much for calling me.
Thank you, sir. I would like to say a few things about Dr. Ganeshanai Panchmal, sir. We feel greatly privileged to have amongst us our chief guest for today, my teacher, Dr. Ganeshanai Panchmal. Sir completed his bachelor's in dental surgery and master's in public health dentistry from Government Dental College, Bangalore. He is one of the founder members of the Indian Association of Public Health Dentistry. Sir has also served as the president and EC member of the Indian Association of Public Health Dentistry. He has also served the Indian Dental Association in varying capacities. He has hosted several conferences and CD programs and symposiums of our specialty. He has served as professor and head of the Department of Public Health Dentistry, Yanapaya Dental College, from 1997 till 2017, during which he has guided many postgraduate and undergraduate students. Sir is also the chairperson of the government's Oral Health Policy Committee and was instrumental in the implementation of Danta Bhagya Yojana. Thank you once again, sir. Over to Rekha, ma'am.
Today I also have the privilege of welcoming resource person, Dr. Manjunath Rajshekar. Actually, Dr. Manjunath doesn't need an introduction because he's such a popular person in the specialty of public health dentistry. He has served India, he has served as an academician and a clinician in New Zealand and Australia also. And we have often turned to him for advice whenever we have required any kind of information with regard to our specialty. Actually, this program should have been conducted more than 6 months ago. That was the schedule which I had planned with Dr. Manjunath, but because of various factors which were beyond my control, it got delayed. I thank Dr. Manjunath for his patience, and thank you so much, sir, for offering to share your knowledge with our students and faculty. I also want to take this opportunity to welcome office bearers and members of the Indian Association of Public Health Dentistry, deans, associate deans, heads of departments, and faculty members from institutions in the Yanapaya campus, in Bangalore, and from across India. I also welcome postgraduate students, interns, and undergraduate students who have joined in from across India. It's an incentive for us to organize more such programs in the future. And I'm also privileged to have our alumni, Vijaya ma'am, who has been a mentor to all of us. And it's also so wonderful to see that we have a large number of support staff from the University group in the forum today. and their support has been the backbone of all that we've done in this department. To end my address, I would just like to say that migration is a feature of globalization. It is something which cannot be avoided anymore.
Thank you, ma'am. I kindly request Dr. Imran Pasha, Reader, Department of Public Dentistry, to deliver the vote of
The
thanks.
sky is no more the limit. So, with these few words,
Good morning to each and
I would
everyone.
like this to be
It's
the
been
first in the series
a
of programs
pleasure
that I
to
hope we
deliver
will
the
be
vote
able
of
to
thanks.
conduct
And I can
regarding
see
educational work opportunities.
many of our faculties who have been part of our institution also being present for today's program. And also Manjunath Rajsekhar sir, for all of you who do not know, so also worked as a faculty in our college. And he was my teacher. It's really an honor to have him. Coming to the part on vote of thanks, I would really like to thank our chancellor, pro chancellor, vice chancellor, registrar, and the dean, Dr. Akhtar Hussain, who has been supportive for most of our programs. And also, I would like to thank all the vice principals of our college and heads of the department who gives us a lot of support from most of the activities of our department. I'd like to extend my warmest regards and thanks to Dr. Rekha Shanai, the head of the Department of Public Health Dentistry, who really thought about this program, who discussed all these things with us. And, ma'am was really upbeat about the program from the day one she had planned. I'm really happy that, it has taken a shape, and there has been more than 250 registrations for the program. So, ma'am, kudos to you and your efforts. That is one thing. And also, I would like to thank the speaker of the day today, that is Dr. Manjunath Rajsekhar sir. What can I say? I have been sir's student, and sir has been our faculty here, and he has motivated all of us. And I still remember when we were undergraduates, we used to be in touch with sir, and sir used to be responding to each and every queries of ours. So thank you, and thank you for accepting to be our adjunct faculty as well. And thank you, sir, for being there. And coming to the former head of the department, Dr. Ganesh Vinay Panchmal. I mean, words fall short for his achievements, for his work, what he has done in the department. We all have grown under his care, and I'm fortunate that I was a UG student in the department. So warmest regards and thanks for. Sir needs one phone call from our head of the department to come and attend the programs. So it's really nice to showcase, how big a family we are, and we do support each other. Uh, Thank you, sir, for being there. And also, I would like to thank all the other faculties who have joined us. And I can see Dr. Praveen Jodali, who has been from faculty of our department and who has joined Manipal College. So thank you for showing the support and being part of the program. I just quickly went through the list of the participants who are there. And our alumni, I can see Soumya had joined, and I'm sorry if I missed anybody's name. I saw Soumya who had joined as an alumni, and I could see the heads of the department. Amita Bashir has joined. Ram Prasad sir from Manipal has joined, head of the department there. So I would like to individually thank if I missed out anybody's name. Uh, it is just that it is quick and I need to wind up because once you give the mic, I will be able to not stop. Thanks to all the postgraduate students of our department who really work hard in planning the day-to-day programs, day-to-day plannings. Junaid for his invocation, and Supriya for being the MC and taking the lead and doing the program. It's nice to see that we are functioning as a well-lit unit. Uh, Thanks to everyone. If I have not thanked anybody else, it is just my oversight, and I apologize for that. Thanks a lot to all the participants who have joined and ready to listen to our talk. I give away the stage to Supriya for the proceedings. Thank you.
Thank you, sir. I would like to take this opportunity to introduce our guest speaker for today, Dr. Manjunath Rajshekar. Sir completed his bachelor's in dental surgery from Bapuji Dental College, Davangere, and then moved on to complete his master's in community dentistry from GDC Bangalore. He also holds a postgraduate diploma in public health from the University of Auckland, New Zealand. He is also the member of Royal Australian College of Dental Surgeons in the specialty of dental public health. Sir also holds licenses and membership of many professional societies, both nationally and internationally. That is Australian Health Practitioner Regulation Agency as General Dentist, Dental Council of New Zealand as General Dentist. He is an honorary member of Australian College of Rural and Remote Medicine, an honorary member of American Association of Public Health Dentistry, honorary member of International Epidemiological Association. Sir also has been awarded second among North Queensland Primary Health Network Dentist of the Year Award 2017 and 2018. He is a team member for National Oral Health Survey and Fluoride Mapping 2002 conducted by Dental Council of India to develop a baseline data regarding the oral health of Indian population to formulate National Oral Health Policy. He is the coordinator for school oral health programs under Commonwealth Association for Mental Health and Developmental Disabled People in Bangalore City. He is the co-member for planning and executing Rapid Oral Health Survey project for rural and suburban of Bangalore City. He started an oral health education museum and information center in Yanapaya Dental College and Hospital, Mangalore. He has been awarded Dr. D.J. Bhaskar Award for top grade in the subject of community dentistry. Sir is currently working as senior lecturer in clinical dentistry, College of Medicine and Dentistry, James Cook University, Australia. He is also associated with our department as an adjunct faculty. Sir, I kindly request you to deliver the keynote address.
Thank you. Thank you. Sorry, I'll just share my screen before I start. So can you all see my screen? Dr. Rekha, can you see my screen?
No, sir, we can't see it. Can you share it, sir?
Yeah, I'll just do it once again. Can you see it now, Dr. Rekha?
Yes, sir. It's visible, sir, now.
Okay. I'm so sorry.
No issues, sir. It's clear, sir, now.
Okay. Thank you, Dr. Rekha, Dr. Imran, and everyone. And thank you, Ganesh and I, sir. I think when the introduction was given, there was a small mistake. I think there was a mention about Oral Health Museum in Enapoya. So that was actually started by Dr. Ganesh and I, sir. And I was there with him when we were developing that Oral Health Museum. And yeah, I would like to thank everyone for inviting me for this lecture. Especially, I'm very happy to share this platform with Dr. Ganesh Shanai sir. So he was there with me in every part of my life. When I was during my post-graduation, I used to reach to for any suggestions. So he was there with to give us guidance at any stage. And also after completion of my post-graduation, I just straight away moved to Enapoya, and I was working under Ganesh Shanai sir. And when I moved to New Zealand, he came over to New Zealand, and it was a great honor to have him here. And sir, it's still, you have not visited me in Australia, it is still due. Okay, so and also Vijaya ma'am, and very nice to have you here as well. So let me start with this seminar. So the topic is higher education and work opportunities for dental professionals, the scenario in Australia and New Zealand. So as Dr. Ganesh Shanai sir was telling, so I'm not here to promote Australia or New Zealand, but I'm just giving you some insight into opportunities to study and work here, because some of you may be looking forward to explore Australia and New Zealand for many reasons. It could be because you want to migrate, you want to settle in these countries, or you would like to do higher studies, and then you want to go back to India. So the situation, it's different for different people. So as Dr. Ganesh Shanai sir was telling, so as we are dental professionals, there is no limit. So we can work anywhere in the world, but there are some restrictions, in the sense there are some hurdles that you need to pass, you need to go through. And once that is done, because this is a healthcare, so definitely any country, if you want to migrate, they want to see whether you can meet the criteria that they want to see in their dental graduates. So yeah, as the proverb goes, God made lands and man made boundaries. So as migration is one of an important aspect in human evolution, so this is an opportunity for me to share some higher education and working opportunities for dental professionals in Australia and New Zealand. But along with this, knowing about the opportunities, we also can see how is the health system in these two countries, and how is the healthcare facilities, and what about the economy of these countries. All these things we can discuss along with the opportunities. So outline of this seminar, I will be talking about health system in Australia and New Zealand, in particular to oral health, higher education opportunities in these two countries, then working opportunities in these two countries, and pathways to study in Australia and New Zealand, and pathways to work and settle in Australia and New Zealand. So if you want to know the working opportunities in any countries, it is very important to understand the health system of that country, because comparing health system is a difficult task. Like from patient's perspective, you see, so when the healthcare facilities are easily accessible, then patient calls it as a very good health system. If the quality is good, when they can afford good health facilities, they call it as a good health system. But from doctors and from dentist perspective, so working condition, if it is good, if pay is good, if lifestyle is good, then we say health system is good. So again, it's different to person and patient and doctor's perspective. So this is not to say that any country has devised the best and most effective solution for every healthcare challenge. Rather, so there is much to be learned from the rich international experience available to us from many countries. So understanding of healthcare systems of different countries can help to sort out policies and practices that work best to resolve issues in individual countries, and can serve as a basis for international collaboration in the solution of key problems. So as I said, so I can't say health system of Australia is the best or health system of New Zealand is the best. So again, it's mainly to understand the healthcare system of different countries will help us to understand the policies and practices. That's the main idea. So coming to Australia, so it is the population of Australia is about 25.69 million according to 2020, and it has got about 5 states and 2 territories. So we have got Queensland, New South Wales, South Australia, Western Australia, Victoria. These are the states, and 2 territories, that is Northern Territory and ACT, so which is not here in this map. So that's the Northern Territory. So the difference between territory and states is that a territory is an area which is under the control of another state or government that doesn't have a sovereignty. Whereas state is like, it's just like a country. It can make its own laws. So it's like a country within a country. And so there are some important iconic places in Australia. So there are major cities like Sydney, Melbourne, Hobart, Brisbane, Gold Coast. So here what you see is Sydney Harbour Bridge and Opera House. And this is in the center of Australia called Uluru. This is a mountain very sacred for the indigenous people who live here in Australia. And this is the Whitehaven Beach, which is very close to the place where I live. Close in the sense it's about 6 hours drive from here. And this is also what we call it as like breakfast with kangaroos. So the kangaroos, they just hang out there and they are very friendly. So I'm looking at the Australian population. So it's about, we have about 25 million people here, and majority of the population, they live along the coastlines in major cities or inner regional areas. So as you can see here, so all these yellow dots, that means that's where most of the population have settled. So the center part of Australia is very, it's about 1% of the population lives in these rural and remote areas. About majority population, they live in coastal areas. So because of these vast distances and uneven distribution of this population affects the provision of healthcare and accessibility of health services, and it makes it very difficult. For example, if any person here at the center of Australia, if we get any head injury, it has to be airlifted from here to reach the nearby hospital, and it takes about 6 to 8 hours. And as you know, in head injuries and any trauma, the critical issue is the time, and he has to be under knife as soon as possible. So because of this uneven population distribution and vast distance, that will affect the accessibility to health services. So according to one of the classification, depending upon the remoteness, they usually classified as major cities of Australia, inner regional Australia, outer regional Australia, remote and very remote Australia. And as you can see here, about 72% of Australian population, they live in major cities. 18%, they live in inner regional areas, 8.2% in outer regional areas, 1.2% remote, and approximately 1% they live in very remote areas. This is like almost like a desert. There is not much vegetation, and there are extreme temperatures in these areas. And I live somewhere here, so it is classified under inner regional area. So this is where I live. It's called Cairns, and anything above that, for example, even if we go more than about 20 kilometers or 25 kilometers from this place, it's like, this is the end. You can't go, there is no road facilities to reach here in this area. You have to go by flight. So Australia's health system is considered as one of the best in the world because it provides quality, safe and affordable, and very important thing is about universal health care for its people. So what do you mean by universal healthcare? So universal healthcare means, according to WHO, it has to be equitable, means it should, those who need the services should get them, not only who can pay for them. So it should be affordable. Then the quality of the health services should be good enough to improve the health of these those people who are receiving these services, and financial risk protection, ensuring that the cost of using care does not put people at risk of financial hardship. So that is one of the best aspect of Australia is we have got access to universal health coverage. So that means that is through a system called Medicare. So this Medicare was introduced in 1984, and it provides free and subsidized access to public health hospital services and to treatment by health professional, but largely excludes dental care. So, but it includes medical services by doctors, specialists, and other health professionals, hospital treatment, and prescription medicine. That means anywhere in Australia, anybody can go and see the doctors, GPs, without spending even 1 cent. And if there is anything emergency, and if they need to see specialist, the referral has to be done by the doctors, and they can see the specialist, and even any emergency services. All the facilities have been covered under Medicare, and it is totally free of cost. That is what I mean to say. It is universal healthcare scheme. It is not just who can pay, but everyone are able to access these services. So Medicare covers all aspects of public hospital services. It also covers some of or all of the costs of other health services. But the problem sometimes is the waiting list. Sometimes if it is not an emergency, for example, any elective surgeries, like any knee surgery, anything like that, you will go under a waiting list. But if you have got something called as private health insurance, then it will gives you a choice outside the public system, and you can get it done in the same system in private clinics with no cost, but there will be some cost, what we call it as the premium. But once that is done, co-payment, once that is done, all the cost will be covered by the private health insurance. So for private healthcare, both in and out of hospital, people contribute towards the cost of their healthcare. But in order to do that, Medicare, because it is a universal healthcare, the population, the Australian residents have to pay something called as Medicare levy, which is about 2% of their taxable income. And private health insurance is in addition to that. So if you have got the government, they promote people to have this private health insurance, and they give some subsidy in this Medicare levy as like surcharge. So they will get rebate on this Medicare levy surcharge. And this is a way to reduce the burden on public health system. So just government promotes to have this private health insurance so that there is a less burden on public health system. So coming to oral health system in Australia, so as I was mentioning, everything is covered under Medicare except dental care. So dental care is not covered. It is just like any other country. It is, I think, except in England and in some other countries, but it is privately billed. So if you look at the oral health system in Australia, so you have got private dentistry, then you have publicly funded dentistry. About 85% is by private dentistry, and only about 10 to 12% is by public funded dentistry. And there are something called as Aboriginal and Torres Strait Islander Hospital. It's called ACHOS, Aboriginal Community Controlled Health Organization. There are about 145 of these ACHOS, which provide health services specifically to indigenous population of Australia. Then there is another type of facility called RFDS, that's called Royal Flying Doctor Service, where in case of remote areas, so dentists can fly in and fly out. So they can go to rural and remote areas through helicopters or through small flights, and they can stay there for a week, provide health services. There will be some facilities already set up in those areas. They can provide health services. It's including doctors, dentists, nurses, diabetic educator, anybody for that matter. So they can fly in and fly out. And defense veteran services. So those who serve in veterans, in Army and in Navy, so they have got free dental services for the rest of their life. and there is a cap on that anyways. And work cover, if anything happens during their work, if any accident, any fall during their working time, so it is usually covered by the company where they are working. That's what we call it as work cover compensation. So private dentistry is mainly out of pocket. They pay for the service. If you do a filling, so they will pay you for the filling. But there is something also called as co-payment. So majority of the population, because they get some rebate on Medicare levy surcharge, say they do go for private health insurance. And when they go for private health insurance, there is something called as extras. So there are two components. One is called basic health services and other one is called extras. So if they choose extras, so dental is covered in that part. That means patients can pay only a part of the dental treatment. If a filling costs about $200, so patient has to pay around $40 and all the remaining amount will be paid by the medical insurance. So there are many health insurance companies like Bupa, Medibank, HCF, NIB, and there are so many health funds that are available for the people to choose from. And there is a concept called as preferred providers or non-preferred providers. That means if I'm a dentist, if I got a private practice, I can be a private preferred provider. Means I can tell Medibank or Bupa that I want to be a preferred provider for your company. That means when I see patients who are having Medibank or Bupa health fund, so I can charge only the fee prescribed by these companies. So these companies, they have got some set prices. If the normal price you charge for a patient without this health fund is about $200, but Bupa sets a price, for example, say about $100, $120. You can't charge anything more than that. In that, patients get more benefit, more amount will be paid by the health insurance. And there is another type called as publicly funded dentistry. So that means Australian government works with state and territory governments to fund dental services and to improve dental health. So this is for a population who can't afford private health insurance, private dentistry. So these public dental clinics, they provide oral health services to this particular population. So this is income tested. So those who have got healthcare card, our Centrelink card, our pension card, so they can access these services at no cost. It is totally free. But only a few percentage of the population are eligible to receive this publicly funded dentistry. So most public sector systems prioritize dental emergencies. Again, it is mainly for emergencies. If it is not an emergency, you go on waiting list. And here the waiting list, they go even up to 2 years. There's a lot of waiting list if you want to access this public dental services, but they are free. But at the moment, what we have called a Child Dental Benefit Scheme. So this was introduced on 1st of January 2014. So according to this, about $1,026 is given to every child between the age 2 to 17 years to cover basic dental treatments. But again, it is income tested. Not everyone is eligible. It is income tested. Only who have got at least one type of Centrelink payment, that is who are below poverty line, so they are eligible for this service, and they can go and see any dentist in private clinics as well. So they can get up to $1,026 free dental services. So there is a large push on this. So that is filling the gap, a universal dental scheme for Australia. So that means now the free dental treatment is only for 2 to 17-year kids, that two particular sector of the population. Now they want to slowly expand this towards covering all the children. And after that, 65 plus, all the elders should come under this. So ultimately, they want to extend this universal dental scheme for all the population of Australia. But actually, till 2014, it's about 2004 to 2014. So this dental care, actually, it was like totally free. It was in Australia, it was totally free, but it was not actually controlled properly. So many dentists actually they misuse this. They start even doing, where it was not necessary. Over treatment was provided, and that's the reason it was a big failure. And they stopped this universal dental scheme in 2014. But they want to introduce this again slowly, step by step. So there are about 24 universities in Australia offering dentistry degrees and courses. And every year, about 600 dentists are graduated out of, and in total, there are about 157 registered dentists at the moment in Australia. And out of these 18,157 dentists, around 11,000 are Australian graduates and 800 are New Zealand registered dentists. So that's the best part. Like if you are registered in New Zealand, you can come and work in Australia. And same way reciprocal, if you are registered in Australia, you can go back and work in New Zealand. So there is a mutual understanding between these two countries. So that's why some of the dentists, sometimes they keep moving in between Australia and New Zealand. And about 5,500 are overseas dentists. So like me, so overseas dentists who have migrated from different countries across the world, and they did some exams here and they are practicing in Australia. So that's about 5,500 dentists. And if you look at the dentist to population ratio in Australia, it's about 1:2020. That means for 2020 population people, there is one dentist. But if you look at the maldistribution across urban and rural, so in urban, it's about 1:1,680. But if you go more rural, it's 1:6,000. So more dentists, they want to work in major cities, in inner regional areas, but they don't want to go towards rural and remote areas due to various reasons, which I'm going to cover later on. So this is the dental workforce in Australia by registration division. So this 24,340, which includes everyone. So that is including, so that's the model here. So we do have dental hygienist, dental therapist, dental hygienist and dental therapist, like a double degree. Then there are dental prosthetists, then dental technicians, then oral health therapists. So all these model of care available here in Australia. And if you look at dentists, about 18,157 dentists out of 24,000. This is according to 2020 data. And if you look at the specialization, so about 1,925 specialists are there. So if you look at endodontists, about 189 endodontists, and actually orthodontists are more, like 648. And look at our specialty, public health dentistry. There are only 16 dentists, only 16 public health dentists across the whole of Australia. And if you look at the state-wise, Queensland, that's only one public health dentist. South Australia, only one. So there's a large demand. There is a huge demand for public health dentists. Plus, of course, across all the forensic odontology, only 20. So across all the specialities, so there's only few specialists there. And if you look at the dental workforce in Australia, so there is maldistribution of dental workforce in the private and public sectors and geographically. So in 2016, the majority of the dentists, about 84%, they worked in private practices. And majority of them are in group practices. Group practice in the sense, if they have in the clinics, if they have got more than one dentist, it's called group practice. And solo practice, about 4,000. And in 2016, only about 6% of dentists, they worked in public clinics. So majority of them, they're working in private clinics. So there are various factors that influence the employment. It's the job availability, family and personal relationship, because you may choose to work in Melbourne or in Sydney or in Brisbane, or you can move on to remote areas, move on to inner regional areas, depending upon the job availability, plus also your family and personal circumstances. In the sense, if your husband is a software engineer and it's very hard for them to get jobs in small cities, they have to go to big cities like Sydney, Melbourne, or Brisbane, like that. And also good mentorship, like if you are in major cities, it is very easy access to see all the specialists. If you have got any issues, if you have got a difficult to do endo, you can always refer them to a specialist. But whereas if you go to rural and remote areas, you don't have any choice. You have to either do endo or you need to extract the tooth in that case. And also the clinical training and experience offered, sometimes when you go more towards remote and rural areas, so the clinical training and experience that you get is limited. And also lifestyle, if you want to be in bigger cities, of course, you have got a lot of choice for food, a lot of, it's like an urban life. So depending upon what you want, so you can choose where you want to work. Just a small note on indigenous population of Australia and New Zealand. So indigenous means this, according to United Nations, it's a self-identification as indigenous peoples at the individual level and accepted by the community as their member. So historical continuity with pre-colonial and or pre-settler societies, and they have got strong links to territories. They have got their own distinct language, cultures, and beliefs. So these are the original inhabitants of Australia before any Britishers came into this land. So they have got their own language, they have got culture and beliefs. And it is estimated that worldwide, there are about 370 million indigenous population across 70 countries. So if you consider Australia, Aboriginal and Torres Strait Islanders are called as indigenous population of Australia, and Maoris are considered as indigenous population of New Zealand. So the oral health status of, these are also called as First Nations Australians. So the oral health status of these First Nations Australians, like any other Australians, is influenced by many factors, especially accessibility, cost, and lack of cultural awareness by some service providers. The colonization, dilution of language, culture, and disconnection from country, these are some of the key factors where these indigenous population, they have lost faith in mainstream health services. So these population, they want to live in remote areas. If you look at the statistics, only about 2% of this population, they live in major cities. Another remaining 98%, they live away from big cities. They want to live in their own colonies. They want to live in bushes, in rural and remote areas. So if you look at the health status of this particular population, so they have got high risk for cardiovascular diseases, high risk for diabetes. Similar way, oral health status is very poor among this population. And I had an opportunity to work with one of these organizations when I moved to Australia from New Zealand. I worked there for about 5 to 6 years, and it was a very rewarding job. People, they respect you a lot, and in the sense, as a profession, they treat you like like their own family members, and they will be very happy. So if you look after their oral, they respect you because you look after them as a dentist and as a doctor. And so just to give an example, some of the players like Ash Barty, she is actually the top tennis player, women tennis player. So she is actually an indigenous Australian. And Boland is a cricketer, so he is one of the indigenous Australian. And Maoris, so these are the indigenous population of New Zealand. Again, but when compared to Aboriginal indigenous population of Australia, Maoris are very strong people, even physically as well, and they have got a lot of control over the system in New Zealand. So there are some differences among the health compared to indigenous and non-indigenous because of various factors, because of historical factors and culturally inappropriate oral health service provision, because they want to seek services only from their organization. As I was telling, it's the ACHOs. They want to go to clinics only they want to see doctors and dentists only through those organizations. And it could be also geographical factors and social determinants. And all these factors, they have made oral health inequalities very strong between these two populations. And there are some studies regarding the oral health status of indigenous, non-indigenous Australians and New Zealand, and also why those irregularities, oral health inequalities, they exist. So if you are interested, you can go through them. And dental workforce in Australia, there is a maldistribution of dental workforce. As I was telling, this is a repeated slide, about 84% of the dentists, they work in private practices, and only about 6% they work in public clinics. And if you look at the number of dentists who work in rural areas, so very remote areas, you can see dentists here, very less amount of, very few dentists go and work in remote areas, but most of the dentists are concentrated in the major cities. But it is not the case in medical health professionals like nurses and midwives, because if they want to work independently, so there is some restriction on them. There is some requirement from the government that they need to serve in rural and remote areas. It's a requirement. Even if any doctors, they want to migrate from any part of the world to Australia, they need to first serve in rural and remote areas. Even any Australian doctors, any Australian students who is doing their medicine, if they want to work independently, they first need to go and work in these remote areas before they move to major cities. That's why we can see here that a lot of people working in rural and remote areas. So this is JCU dentistry where I work. The main focus on JCU dentistry is on regional, rural, and remote placement. It mainly focused on training a fit for purpose regional, rural, and remote health workforce so that the distribution of dentists is equitable. And this is where all our students, they go for placement, like what we call it as internship in India. The same way in year 5, students have to go to different parts of the country and they need to work under someone. So JCU, we send them to different places, especially in the rural and remote areas, as you can see here. So they are sent to different parts of Australia, and that to rural and remote areas. So there are some benefits and there are some challenges if you want to work rurally. Rural lifestyle, if you like it, if you like peaceful life, definitely. If you don't like traffic, rural lifestyle is really good. More challenging job opportunities. As I said, if you want to, you can see a lot of trauma cases, you can see a lot of emergency situation you may have to handle by yourself when you are staying in rural. And wider range of patients and clinical exposure is very good. You can enjoy a good patient base. There are so many financial incentives, like government will offer some salary sacrificing opportunities. Some, if you want to open a dental clinic in rural and remote areas, they provide some incentives and also some professional supportive network, like the doctors, the midwives. You can form a good community network if you are in a rural and remote area, and there's a lot of support from each other. But there are some challenges because you may feel socially secluded, poor access to education. Like if you have got a kid and if you want to give them good education, there is some basic education, but for higher education, definitely you may have to move on to big cities. and limited job opportunities for their partners if they are not in medical field. So this is just an example. This is where I live, Keynes, and all this part of Queensland. So I live in Queensland. So all this part of Queensland is considered as rural and remote area. So for example, if a patient from here, if he wants to see dentist, he may have to drive all the way either to Mariba, this place, or to Clifton Beach here. So that's about 400 kilometers. That's about 4-hour journey. Even just to see a dentist, just for a checkup and clean, or even for a filling, they may have to drive. And even there is public transport facilities are there, but they're very, very limited. So it's a challenge for them. Medical facilities, no problem. They have got doctors. They have got doctors here, Cooktown, Lakeland, Laura, everywhere. But to see a dentist, they may have to travel all the way from Cooktown to Keynes. Just a small background about New Zealand. So New Zealand is a very small country. So it's the population of the whole country is about 4.4 million. That's it, according to 2012 data. And it has got North Island and South Island. And the biggest city in New Zealand is Auckland. That's in North Island, but the capital is Wellington. And this is the southern part of South Island. This is southern part of New Zealand. So which has got only few main cities. That is Christchurch, Dunedin, Queenstown, Invercargill. Otherwise, all these are mainly the tourist attractions. And there is only one university for the whole of New Zealand. That is Otago, University of Otago in Dunedin. So it's a very beautiful country with beautiful landscape and beautiful beaches, but it's very cold. You can't touch. It's so beautiful, but you can't touch water. It's a very cold country. Auckland is better. It's busy, and it's a biggest city in New Zealand. But the South Island is very cold, but it's very beautiful. So looking at the New Zealand dental care system, again, the majority is by private dentists. Only a small amount is by the public funded dentistry, hospital dental units, and school and community dental services. And there is something called as ACC, means any damage due to accidents, it is covered under a separate unit called as ACC. It is totally free. If you fall and break your teeth, and if the teeth has to come out, even this ACC will pay for your implant. It's totally free of cost. And the strength is access to care for children, and up to 17 years, everything is free for children here, excluding orthodontics. And ACC is a no-fault system. They won't ask you any question. If it is because of trauma, it is totally free. And there's only one dental school in New Zealand. That means there's a uniformity of dental education and high standard care and up-to-date technology. But the weakness, again, it's the same thing like Australia. It is the maldistribution of dentists and oral health inequalities. And if you just look at the stats in New Zealand, only about, this is the old data though, only about 2,000 active workforce in New Zealand. Majority of them are male, and only about 1.5% are Maori dentists. Dentist to population ratio is almost similar to Australia. In Australia, it was about 2020. For 2020 population, there is one dentist. It's almost similar. And specialists are only about 12.2%. And there's a maldistribution. That means if you go to this part of New Zealand, you can't find any dentist. And also here, you can't find any dentist. They have to travel all the way from here. They need to go to Christchurch to see a dentist, or to Queenstown to see a dentist. Even if you look at the dental specialties, only about 219 specialists. And actually, there are more public health dentists here because there is a public dentistry course in University of Otago. So if you are looking at higher studies in Australia and New Zealand, there are two main avenues. One is called the Doctor of Philosophy, that is the PhD in any specialty, and the other one is the Master of Public Health. These are the two avenues. So if you want to do PhD, if you are a periodontist, if you are a pedodontist, if you are a restorative, you can choose a particular topic in that particular area and you can get into PhD. And sometimes these you can get some funded for your study. Most of the fees will be covered by this funding, but only the living cost you may have to bear. And regarding Master of Public Health, so this is mainly related to general public health, not related to dental public health. Because if you want to dental public health, first thing is you need to register here as a general dentist and then need to do a dental public health. But you can do Master of Public Health. So once you do this PhD or MPH, you may have to depend, like sometimes it's very hard for you to get a job straight away. There has to be some avenues, there has to be some opportunities at that time of graduating so that you can get in there. But it is again, if you do PhD in any particular dental specialty, only few dental universities, universities in Australia will take you as a faculty at this stage, because they want you to first get registered in Australia and also in New Zealand before they offer you any job. But working opportunities, if you are looking at, the best and only way is to pass your ADC examination. That is Australian Dental Council examination is the only way. Even if you are done PhD or MPH, if you want to work in Australia, what my personal suggestion is to pass this ADC examination. So Australian Dental Council is it works to protect the health and safety of the public by ensuring dental practitioners meet the high standard required of dental professionals in Australia. It is an independent accreditation authority. Assigned accreditation functions for the dental professionals. So there are 3 stages if you want to get registered as dentist in Australia. So that is, first thing is called as initial assessment, then is written examination, then you have to do practical examination. So for initial assessment, eligibility is you have to be a dentist. You have to be a dentist in your country. So if you have got a dentistry from a particular from a good university, that's all they want. So once you have that, you are eligible to write these examinations. And first they do the initial assessment. They check all your names, the name written in your mark sheet, the name that's written in your degree certificate is all coinciding, everything is valid. So they do the initial assessment, and there is a time frame of 8 weeks to do this, and there is a cost involved with this. And this, once you get this initial assessment, this is valid for 7 years. That means now you can get your initial assessment, and you can give your exam after 3 years or 4 years. It is still valid. So once this is approved, once you have got your initial assessment done, then you can move on to written examination. So written examination is a 2-day examination, and there is a cost involved with that, $2,000, and they will test. This examination is mainly to test your application of knowledge to clinical practice. So whatever the study that you have done, like knowledge that you have done, or the knowledge what you have applied to clinical dentistry, how you are applying your knowledge to clinical dentistry, that's what will be looked at in the written examination. All the questions will be clinically oriented questions, and it is valid for 3 years. That means you don't have any limit for practical examination. You can give practical examination n number of times, but it has to be done within 3 years. After 3 years, this written examination is not valid. That means you need to come back and give this written examination once again if you want to do practical examination. So this is about 2,000 Australian dollars, and practical examination is about 4,500 Australian dollars. This is at this moment, but it is a costly process. But once you complete your examination, I don't think you regret for this, spending this money. So the written examination is the second stage of the dental practitioner assessment process, where it determines you know how to practice dentistry in Australia by assessing your knowledge of the science and practice of dentistry and clinical judgment and reasoning skills. Everything here is like clinically oriented questions. Clinically oriented question will be asked. So there are 2 days. This is a 2-day exam. So you have got 4 sections, section 1, section 2 in day 1 on day 1, and section 3 and 4 on day 2. And there will be around 70 questions in each sections. So ADC written examination, so it mainly covers the following topics. As you can see, it's almost covers the entire different specialties in dentistry. So the ADC uses scenario-based multiple choice questions. It is mainly MCQs, but it's a scenario-based question. That means they will give you a scenario. A patient comes to your clinic who is on warfarin, and he has got severe pain, and how do you manage this patient? And they may give you some radiograph. You may have to come to a diagnosis, and then how you manage these patients. And they may ask you a MCQ like warfarin. So what is INR? So how do you check your INR, and what is the best INR if you want to do this extraction? Or if it is more than INR level is more than 3, what you want to do? So this clinically oriented question will be attached to this particular scenario. And on the clinical day, so there will be clinical skills will be examined. It mainly focuses on the demonstration and assessment of the professional competencies. This is all available in the website. So if you want, you can go and have a look later on. So it's mainly about the clinical information gathering, diagnosis and management planning. They will give you some radiographs and some cards related to that particular radiograph of a patient and a brief history about that particular patient. And they ask you to do a treatment plan for that particular patient, depending on what the information they have given. So that may be one skill that they will be looking at. The other skill, it could be the communication skill. So there will be an actor who is acting like a patient, and you are a dentist, and you need to talk to them, and how you elicit information from them regarding the condition, and how you communicate with them regarding your treatment plan is what they are looking at. And lastly, the infection control. Again, it is a very important thing that they will look at it. So when you are doing the examination, are you are you touching everywhere? So are you following the proper PPE? Are you doing good infection control methodology? All these things will be considered very seriously in your examination. So just go through the next slide. So this is what we call it as OSCE. So in those OSCE examinations, so there will be a treatment plan, as I explained to you, or it could be a communication skill that they will look at it, or there will be some video-based scenarios. Based on that, you may have to come up with some treatment planning, and you may have to do, of course, you definitely have to do some procedures and mannequin. So these are some of the examples: taking history from a simulated patient, explaining a diagnosis and management plan to a simulated patient, means there will be an actor. Then establishing a risk profile for a simulated patient, like if a patient is on bisphosphonates. So how do you manage this patient? And he comes to you with severe pain and you need to extract a tooth. How you are going to manage? Because as a general dentist, you are supposed to know this. And communicating with health promotion strategy to assimilated patients, then how do you manage a medical emergency in your dental clinic? If there is any asthma attack, how do you manage this in your clinic? Then how do you take an intraoral radiograph? Then how do you design a partial denture, like a cast metal partial denture? How do you design in a given clinical situation? These are some of the examples. And this is again, another important task is about the technical skill. They would like to look at it, mainly about the endodontics and fixed prosthodontics, where you may have to perform, for example, the preparation of a carious tooth or teeth, the restoration of a prepared tooth or teeth with resin composite or with amalgam, and you may have to do a crown preparation and a temporary crown on that, and an endodontic procedure on a simulated tooth. So you may be asked to do a class 2 restoration and class 2 cavity preparation, or it could be a class 4 anterior restoration. So it totally, on that day, so you will come to know what you will be doing it. And these are some of the rubrics that they use. Just an example to give you. So if they ask you to do a composite restoration, then they will be looking at these guidelines, and there will be assessing against like whether it's a very good, satisfactory, borderline, or unsatisfactory, like how you are handling the material, and what about the restoration integrity, tooth restoration junction of the restoration and tooth not detectable by probe, then it's a very good one. If there is any deficiency or void, it is straight away goes to unsatisfactory. That means it is fail. Same thing, cervical overhang should not be there in a class 2 composite restoration. If there is any overhang, it is totally unsatisfactory. And if you damage your adjacent tooth or assessment tooth when you are doing a cavity prep, it is straight away fail. So these are some of the guidelines. Actually, we use the same guidelines for year 2 students in simulation clinic when they're practicing their class 2s. So working structure in Australia and New Zealand. So as I was explaining to you, so you can work in private practice, you can work in your own, you can open up your own clinic, or you can work for others for salary or for commission. So usually 40% is a standard rate here if you are a good experienced dentist. So 60% will go to the owner and 40% is to you if you are working for somebody else. Or you can work for a public dental clinic or a government clinics, which is like based on salary. So you can have a fixed salary, whether you do more work or less work, nothing, it doesn't matter, but there is a fixed salary. Or you can work in universities, both in academics and clinics, or only in academics, depending upon the requirement of the university. And as I was mentioning, you can work for RFDS, like fly in and fly out dentist. You can go out to remote areas for 15 days, stay there, provide all the oral services, and you can come back. Again, it could be based on salary or commission. Then you can also work as a researcher. If you are a PhD, if you have done your PhD in Australia or New Zealand, you can join in any universities or in any government research unit, and you can work as a researcher. So this is a website to look at the jobs, like seek.co.au. So this is a website where you will be looking at when you are looking for a job. And if you look for a dentist, as you can see here, there are at the moment, there are about 3,344 jobs. That means there is an acute shortage of dentists here in Australia. So this may also include some oral health, therapists, technicians, and everyone, but majority it's dentists. So there are a lot of opportunities for dentists to work in Australia though. So even For example, even in our clinic, we are looking for a dentist, but not able to get any dentist from past 1 year. So it is such an acute shortage of dentists in Australia. So just to conclude, I just want to show this YouTube video. So that's about the university that I am working.
Sir, the video is not audible.
Oh, okay, sorry. Okay, I'm sorry, I'm not sure how to make this. Anyway, I can share this video and you can have a look at this. It's just available in YouTube as well. So this is just a last slide that I have. And just to conclude. Yeah, so just to conclude, as I was telling, so there is a big opportunity if you want to migrate to Australia and New Zealand to work in private sector or public sector. The way that you want to choose is definitely there's no limit. And these examinations are not easy though. So I'm not telling they're very easy examination. They are tough, very stressful, but at the same time, it is not impossible. If I can do it, I think everyone can do it. So it is not something impossible. So you just need to focus and you need to have that goal in front of you to do this examination. And basically, you need to do this examination if you want to work as dentist in Australia or New Zealand. And I'm not stressing more about New Zealand because once you get registered as Australia, you can straight away go and work in New Zealand. There is no other separate examination that you need to do. Actually, New Zealand, they had their separate examination before, but now they have taken out that separate examination. If you want to work there, either you need to do a Canadian examination or an Australian examination. If you pass either of these two, you can go and work in New Zealand as well. And I actually first migrated to New Zealand. I gave my New Zealand registration examination, and after registration, because as I can work in both the countries, and then move to Australia without any examination, and I can go back to New Zealand at any point of my life. I can go and work in New Zealand. And thank you, everyone. Hopefully, it's given you some information about the health system of Australia. How does it work? Because if you just want to migrate, it's not just the working environment that you would like to look at. It's about the health system, how safe you are in this health system and how affordable the health system is, and other things also you have to look at it. And as I said, this is not to promote Australia or New Zealand, but if you just want to move out of India for some other reasons, if your husband or your partner is settled in Australia, and if you want to look at the opportunities and avenues to settle here, or if you want to do some higher studies and you want to go back to India and serve, so that's the main intention that I would like to, I wanted to discuss with you in this through this seminar. Thank you all. Thank you for giving me this opportunity to share this, and I'm happy to take any questions from you.
Thank you,
Dr.
Manjunath.
Thank you, Dr. Manjunath. That was a very informative session. So the session is open for discussion. If anybody has any queries, can ask their questions, please.
Hello, good afternoon, sir. Hello. Hello,
Yes,
sir.
sorry. Yeah, it's fine. It was
I
on
have a
mute.
question for you, sir. Dr. Abdulaziz is here, sir.
Yes, Abdul.
Yes, sir. Wanted to know about short-term courses in Australia. Like, I'm periodontist, related to some to my field. Any short-term courses like 6 months or 1 year, or
Okay,
any courses?
Okay, so when you say short-term courses, you mean, is it like like for example, Royal Australian College of Dental Surgeons in your specific field, or is it about the clinical-based studies?
Clinical based, sir. Like, for example, I can give you laser or any advanced surgical procedures which can be.
Yes.
Yes,
yes, definitely, Dr. Abdul. So there are some courses available, but again, you can't perform these procedures on live patient. You can do it on mannequins, you can do it on simulated patients, but not on real patients. That's the thing. Like, unless we are registered here, so you can't touch patient. That is one criteria. But there are courses definitely available, like it's called diploma courses, postgraduate diploma courses in across all the field, like even endo and ortho. There are so many courses that are available, but everything will be done on mannequins, unfortunately.
Thank you, sir.
Thank you.
So we have come across a few queries during the registration process from our audience. So can I present it to you, sir?
Yes, please. Yeah.
The first question was, is there any assistance regarding ADC exams? Means they wanted to know regarding the preparation, any coaching needs to be taken, and what is the current scenario with ADC pass outs?
Yeah, so regarding the training, so definitely everything is available if you pay money. So that's the thing. There are so many dentists, they are doing this coaching, but again, you may have to pay towards those training sessions. But if you need some guidance, everything is available in their websites, like what type of examination pattern it is. So everything is available in their website. So if you go to their websites and if you can follow the instructions, you can have your own mannequin at your place and you can start learning. Of course, there are some crash courses which you can do. Just before the exam, if you can do some crash courses, so that will be helpful. That will definitely give you an insight into the examination pattern. But strongly, I advise maybe you have to go and work like a dental assistant, or just stand next to a dentist in a private practice, just to observe how they are communicating with the patient, how everything dentistry is same wherever you go, but it is just how you are communicating with patients, how you are presenting your treatment plan may be slightly different. So and also the type of material that they are using. So these things, actually, you need to work or just go and observe a dentist in a private practice. So that will give you a big impact on your understanding how the Australian scenario works. And just regarding your, like, for example, any preclinical work like cavity preparation or restoration, there are some rubrics that are already available on their websites. And you have to just go according to, like, if they say 0.5 mm, they definitely look at like 0.5 mm. So it's so accurate they look into. So like, for example, crown preparation, if they say 1.5 mm on the labial and 0.5 mm on the lingual, you need to go for it. Go for that particular measurement. So just in short, the answer for that is definitely there are some courses available, but they are, again, you need to pay towards those courses.
So the next question is, are there any financial support services available in India for the dentists who are trying to come to Australia or New Zealand?
I don't think so. But if you want to do PhD, so sometimes the fees will be entirely covered. It will be funded by the type of the study that you are choosing. It is totally the fees will be covered through that funding. But the living expense, so that's definitely not covered. So in that scenario, you may have to work for someone like but when you are doing your PhD in any particular university, there are so many job opportunities because you are already a dentist. So there may be some research like a resource person that you can work as, or like a dental assistant you can work as. In that way, at least you can also get to see how the dentist work with patients here in Australia, but not really you get any support because it's totally private. So I don't think you get any support in India.
So the next question is from a public health dentist perspective. If there are career options such as being able to work as a biostatistician, epidemiologist, or a public health personnel, what is the scope?
Yeah, so definitely if you have got a PhD or if you have got any what you call like a postgraduate diploma in epidemiology or in those particular field, you can definitely get into some of the university. Because I know one dentist, I mean many dentists for that matter, they are not registered dentists, but they have completed PhDs and also some postgraduate diploma in epidemiology who are working in University of Sydney. So you can get into those type of jobs for sure, but you should have some degree. You need to study those degrees in Australia or New Zealand, then you can.
So the next question is, any insights into current oral health policy status in Australia?
So definitely there is something called as National Oral Health Strategy. They have got like 2015 to 2024. They want to achieve this, and they have got goals and strategies and the way to measure those goals. So like, for example, the very important thing is about meeting the inequalities between the indigenous and non-indigenous population. So there is some strategies that they have put through that policy and they want to achieve within 2024. Same way, reaching the rural and remote area of Australia. So they have got a strategy and the policy to meet that and to measure it. So their aim is to achieve before 2024. Started in 2015, before 2024, they want to achieve that particular goal.
So the next one is, can we do online public health courses in Australia or New Zealand? And if so, are they recognized?
So definitely not online courses available. Actually, even though I'm a public health dentist from India, because when I applied for my specialist registration here, there was no actually, there is no public health dentistry course available in Australia at all. So during that time, that was about 3 years ago. So as there was no prescribed, what do you call, like a syllabus for public health dentistry, they couldn't compare my whatever that I have studied with their syllabus. So that's the reason they said, no, we don't have anything to compare. So we can't really give you the specialist registration. So then recently, 2 years ago, they started Masters in Dental Public Health in University of Sydney, where I am doing it online to get registered as a specialist here as a public health dentist. So definitely online thing is not available. Hello, sir.
So what is the scope after PG diploma in health sciences?
Health science in the sense, is it about public health or what do you mean by health science? Sorry.
Public health, sir.
Public health. So it's about master of public health or master of dental public health. So if you are a master
public health, sir.
Yeah, public health. So yeah, definitely you can get into any like there are two avenues. One is you can get into university as an academician, or you can get into research. Like you can attach to any universities and do some research activities, or some government institution where you can be a research person. Yeah, there are good opportunities after MPH.
So what is the situation after ADC registration, particularly about visa and PR?
Yeah, so somebody has to sponsor you if you want to, of course, once you've done the registration examination, so sponsorship and getting visa is very easy, but there has to be some employer who need to sponsor your visa and to offer you a job. And I don't think any problem to get that thing. So it's very easy. So there are so many practice owners, even I know so many practice owners, they're looking for dentists. I don't think it's going to be an issue, but definitely you need somebody to sponsor your visa.
So one last question. What are the books and material needed to be referred for clearing ADC exam?
It's definitely what you have studied as undergraduate. So it's the same textbooks, everything is the same. But there are some problem-oriented textbook. Like there is a book called Problem Solving in Dentistry by Odell, by an author called Odell. So that's a very good book, which is mainly focused on the clinical-based scenarios. And there is a book called Problem Solving in Prosthodontics, Problem Solving in Periodontics. So you can definitely refer all those books. And there is something called as therapeutic guidelines in Australia. So like for example, if patients is on any medications, so there is particular guidelines developed by Dental Board of Australia, which we need to follow. And these guidelines, everything has been like warfaring. So INR has to be this much. What you have to do if it is more than 2, what you have to do if it is more than 3, and what are the guidelines to treat a patient with bisphosphonates. All these guidelines has been written and it's available in a book called Therapeutic Guidelines. And it's very important for you to go through that. And apart from that, it's just the general textbooks. But really, you need not to go and study anatomy, physiology, and all those things. But applied aspects of anatomy, like maybe a nerve that are involved, like trigeminal nerve in your when you are doing oral surgery or when you are doing any extractions, those particular topics related to clinics are very important.
Sir, how difficult is it to start a private practice?
It is, the setup cost is really very high because of all the guidelines and all the requirements, because here we work with blood, saliva, and water. So they want to really segregate all these infectious things. Of course, like in any other country, the setup cost is definitely higher than any other profession. So same way here, it is definitely costly affair. Like even for a radiograph, you need to get the radiographic license, and also get your OPG or CBCT if you have. It has to be validated every year, and your sterilization sterilizer has to be validated every year. So there are some ongoing costs and there are some setup costs, but the return is almost you can definitely cover from day one. So there is nothing to worry about that.
Sir, another thing I wanted to ask is like, suppose a dental graduate from India goes to Australia and before registration wants to work as a dental assistant in a clinic. So, do they have to have any specific qualifications or experience, or they can go after
No,
their
they do.
internship?
Yeah, they need not to have any particular course for that. It is straight away, it's on job, like training on job, so they can straight away get into that. Again, there is a lot of dentists looking for dental assistant. It should not be an issue.
Thank you, sir.
Thank you.
Manjunath,
Hi, sir.
that's very, very nice of you. I've been listening to you. You have been very, you made it very, very clear and very clear. I don't think anyone had got doubt now remaining, because you cleared it very nicely. And I'm very happy that you are doing very well, and there is still scope for any dentist visiting Australia. And that's very nice to hear from you. And you have taken a good decision from moving. New Zealand is a beautiful country with such a small population, 42 lakhs. And I was just mentioning to staff here, Lekha Madam and others, that a place that such a small population of 42 lakhs, having 6 international airports, no snakes, no crocodiles, nothing. And it's a beautiful place. But I know each one has got a professional aim and a goal. So you live and you shift the country from one to other. And it's your choice. Your choice. And as you said, I extensively toured Australia, but sometime near future, I'll definitely visit you.
Yes, sir. Sure, definitely.
But I'm very happy to see you, and you have beautifully, very nicely, you answered the questions, and you clearly told everything. I'm pleased with that. Thank you very much. God
Thank you,
bless
sir. Thank you so much.
So one last question. What is roughly like the approximate budget required to set up a dental clinic in Australia?
It's a very hard question, but I'll try to answer in brief. Like, it's about $2,500 to $3,000 per square meter. Like, if you want to have like 100 square meter clinic, then it's about $300,000. Or I can say that's only the setup cost. So plus there has to be some, the equipment cost and all the radiation, all the sterilization, all these validation costs are in addition to that. So, but I can say for 3 to 4 surgery practice, it's about $300,000 for just the setup. That's the build cost. Plus the equipment is another $150,000 to $200,000. I can say $500,000. You need, like $500,000. Definitely you need to start a practice here.
Thank you so much, sir. If anybody has any other queries, you can put it in the chat box or mail it to us. We will forward it to our resource person and share the information with you all. certificate to our resource person, Dr. Manjunath Rajshekhar, as a token of gratitude. Thank you once again, sir. The session was very informative. I'm sure it has benefited a lot of people.
Thank you everyone, because it is a very I don't know where, because few people will be looking at this in a different perspective. Somebody looking that as migrating towards study, somebody wants to work, somebody wants to do higher studies. So there's a different aspect. It's really very difficult to cover all the aspects, but I have try to give you a small, scenario how the health system in Australia and New Zealand works, because it's very important for you to know the health system and then working and higher education opportunities in Australia. Hope it's helpful, and I'm happy to answer any questions in future. If you want to contact, that's fine. You can contact me through email. And if you're really serious in taking some examination and proceed in that direction, I'm happy to give you some contacts where there are some students who have recently done their examination and they are already started working in Australia. You can talk to them, because I'm already like now 10 to 12 years old. The system has definitely changed. So it is good to have to be in touch with somebody who has recently completed. So I'm happy to share that with you.
Thank you so much, Manjunath sir. We really appreciate you sharing your knowledge and experience with us, because I think it will be really helpful to our students who are planning to move abroad, because they often go there and then they, they have so many questions on which course to take and what are the requirements. And we thank you also for your generous offer of help, saying that you'll share your experience and contacts. Thank you so much, sir.
No worries. Thank you, Dr. Rekha.
This certificate is for all our participants, which will be mailed to you all through your registered email IDs. Now we have come to the successful ending of today's keynote address on the topic Higher Education and Work Opportunities for Dental Professionals, the scenario in Australia and New Zealand. I kindly thank each one of you for your valuable presence throughout the virtual session. Thank you all. Now I kindly request everyone to rise in your own places for the national anthem.
जनगणमन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात द्राविड़ उत्कल गंगा विंध्य हिमाचल यमुना उच्चल जलधर तव शुभ नाम जाने तव शुभ आशीष गाहे तव जय गाथा जय भारत भाग्य विधाता जय हे
Thank you once again.
Thank you.
Kindly fill the feedback form.
From any of the participants, we will forward the queries to you, sir. Request you to help us out, sir.